And in this hour, let's talk about tuberculosis, simply referred to as TB. It is an infection disease that most often affects the lungs. It is caused by a type of bacteria that spread through the air when infected people cough, sneeze, or spit. Now, the World Health Organization estimates that 1 out of every 4 persons you meet anywhere in the world has at one point contracted TB. That's quite scary. But not all exhibit symptoms. It is a major public health threat in Ghana and globally. It is one of the top 10 causes of death according to the WHO, and it's estimated that each day nearly 3,500 people die from TB across the world. TB Day 2024 will be commemorated on Sunday, 24th March, under the theme, Yes, We Can, in the studio to help us understand TB better and to help us with the knowledge to react against it is Dr. Rita Patricia Frimpong. I'm your Deputy Programs Manager, the Ghana TB Control Program. Dr. Manya, you're welcome to the Pulse on Joy News. So, I mean, I've met like 20, 30 people today. So that means,
yes.
I mean, every 4 that I met, one had or at some point had TB. And that's quite scary for me, looking at, I mean, the effects of it on the human body.
Yes, so when we say that 1 in 4 people that you meet has had TB infection, it doesn't mean they have the TB disease.
Okay.
You know, the organism is such that once it gets into your lungs, it doesn't put you down at the moment.
Right.
It waits the time your immunity is very low, then it also starts manifesting. So though you may be harboring the bacteria, you may not be showing any symptoms. That is why we say that 1 in every 4 at any point in time might have inhaled air that had the bacilli in it. So that is the meaning.
So maybe you may have had it, but because your immune system is strong, it was able to fight it. Good. Is that the case?
Yes.
All right. So I mean, is TB still a major health concern in Ghana?
It is. Most of the time, people think that it's an ancient disease, we have advanced,
right,
so we don't need to talk about it. Let me give you something simple. You know, in our health facilities, anybody who comes, we screen the person. So we ask you simple questions. Do you cough? Do you have a fever? Have you lost weight? Have you lost appetite? These questions seem to be everyday questions. Right. Yet, the people that we ask them, and they say yes, we take their sputum sample to the lab. And just last year, over 19,000 people in Ghana had TB.
19,000
19,000
across the country.
Yes. So it should tell you that the disease is still present with us, and we need to do all that we can to end it.
And this is even for those who came to be tested.
Good.
So it means that there may be a number, the number may be higher for those who've not been tested for TB.
Yes.
Because I know, for example, people cough, and their first, reaction would be to go to a pharmacy or a drugstore to get a cough mixture.
Yes. So the WHO estimates that in Ghana, per our population, there are 44,000 that have TB every year. So if we were able to diagnose 19,000, it means that we have about 25,000 people that we didn't get to. So now what happens to them? Okay. They are in our community. Some of them will die unnoticed. Others would infect other people. So that is how the disease keeps transmitting. So in this year that we are looking at, yes, we can end TB, we have added over-the-counter medical shops. We have added pharmacy shops to the work that we are doing, because we realize that many people will first visit these points before they come to the facility. And if the cough is not really bothering them, they will not even enter the health facility. So we are working at over-the-counter medical shops and also at the pharmacy shop, where you'll be screened when you come there to get a cough mixture, and then your sample will be taken there to the facility. You don't even need to bother going to the facility, and we will get your results too.
So is it related to the quality of air or from other sources?
TB is not related to quality of air. The organisms are so minute, you may not see them. So even in a room that you think, oh, I'm in an air-conditioned room, this place is neat, it's cleaned, the organism just needs the air, and it suspends in the air. Usually, it will not drop on a surface that you say, oh, I'm cleaning the surface, so it's there. It will keep suspending in the air after some time before it settles on the surface. So everywhere that you are, whether the air is clean, whether the air is polluted, the TB bacilli is. And let me say this.
Right.
Many people travel from Ghana, they go to US, they go to UK, and then at the health facility, we get a call. There is a Ghanaian who went to this country, he has TB and he wants to come back home. People think that when you go there, oh, it's a neat place, so there is no TB. But TB is everywhere.
It's everywhere.
Yes.
It doesn't matter whether you are in Ghana or you are in the US.
Everywhere.
You can be, yes. And so, I mean, have we attached enough seriousness to this as a nation?
Yes, a lot of seriousness. When you come to the National TB Control Program, you have all the cadre of staff that work in a health facility at the program level. So you see, although we are not sitting in the clinic, we are there, we are teaching our colleagues, we are monitoring what they are doing, and government is also doing its best to provide us with resources, although they are not enough. So, I mean, I'll use this, your platform, to also lobby for more equipment. We use the GeneXpert machine to diagnose TB. As a country, we have 261 districts, but the GeneXpert machines we have are 201. It tells you that not every district has the machine.
But is it even distributed evenly? I mean, the 200.
Of course, I mean, definitely
I'm sure you have
not.
more in Accra and Kumasi.
More in Greater Accra and Ashanti
Yes.
region. Yes. So we need more of the diagnostic equipment so that anybody that goes to a health facility wouldn't have to go to another place for the test to be done. So what we are doing is that another level of seriousness we've attached is that if you attend a facility where they don't have the diagnostic machine, the sputum sample is transported to the other facility that can conduct this diagnosis. Then we get your results.
But again, the issue about the seriousness, beyond government intervention, the individual, I mean, why should I pay so much attention to TB? Is this something that can easily kill me?
TB is one of the top 10 killers. You know, when COVID came, everybody was running away. But after COVID, TB is the #1 cause of death. It even kills more people than HIV. And for many people, as for coughing, people will not cover their mouth when they are coughing. They will not cough in the elbow. Now that we are even not wearing masks, we just cough anywhere. But what we need to advocate and tell everyone is that anytime you have a cough, please, now, mask wearing is not anything new to us. Please wear your mask. And again, if you don't have your mask, cough into your elbow or cough into a handkerchief, a tissue, and dispose it off. When you don't feel well, you have a cough, you have a fever, please visit a health.
I was just coming to ask about the symptoms to look out for.
The
so
TB symptoms.
You are alive to your responsibilities.
Yes, it's a myriad of symptoms.
Okay.
So, I mean, the predominant ones is cough, we have fever, cough of any duration. At first, we're restricting ourselves to 2 weeks and realize that many of the people that have TB may not have been coughing for that 2 weeks duration. So, fever, chest pain, weight loss, difficulty in breathing. And for the young children, you would see that the child is failing to thrive. That means that a child at 3 months, at 6 months, that should be sitting. At 9 months, that should be crawling or taking the first steps. That child is not even standing. So that child is failing to thrive. The child is not gaining weight as it should. So these are the symptoms that we look out for.
And that could be TB.
Yes, TB causes that. And one of the major things is that a lot of people will complain of back pain, getting all manner of analgesics one after the other. TB can affect the bone, okay? There are people that TB also affect their brain and they become unconscious. So sometimes some headaches, it may not just be a normal headache. That is why I want everybody to visit the health facility when you are not well so that you'll be properly taken care of.
So the observation is on the 20...
On the 24th.
On the 24th.
But this year, because 24th falls on a Sunday,
right,
everybody wants to either go to church or attend a party here or there. We are celebrating the day on Friday, 22nd of March.
And that's tomorrow?
Yes, in the Eastern region, the Jubilee Park. Okay. So we would be there. We'll be supported by government. We'll be supported by our chiefs. We'll be supported by market women, school children, teachers. Everybody is coming to join us to celebrate this important occasion.
And what's the national call as you celebrate this, the day tomorrow?
This year, the theme is, Yes, We Can End TB. This theme is to bring out some hope in us that as individuals, with a little effort, we can end TB by covering our mouth when we are coughing and not stigmatizing those who have TB. When we stigmatize people, they are afraid to come out.
Right.
And they are unable to tell their family members, I have TB. You know, when you have TB, we come to your family, and then those who are closer to you, we also screen them for TB. Those who do not have, we put them on a medication.
Okay.
It's called a TB preventive treatment. So yes, we can end TB. Yes, TB is curable.
The last time I checked, it was free too.
Oh, it is free. So when we say yes, we can end TB, the one who has the TB disease, you can also say that.
Of course.
Yes, I can end TB. The family member would say, yes, I can end TB because I'm taking TB preventive treatment. And for Joy FM, oh, yes, you can end TB. Giving us this platform, Joy TV, all your stations. This week, we have been moving from one station to the other. That is what we are all doing to end TB.
All right, thank you very much, Dr. Manyo, for coming through. And the national observation is tomorrow, the Koforidua Jubilee Park. That's where the national event is taking place. And the theme is, yes, we can. And that is what all of us will look forward to.